Hi, Chris Hayes here from Hayes Physical Therapy. Today I want to talk to you about golfer's elbow. Golfer's elbow actually occurs on the inside of your elbow. And actually I have this condition now, which is why I'm wearing this brace. And it's not from golf for me, it's from the trade that I do where there's a lot of manual therapy and it's inflaming my flexor tendons. So let me tell you what you need to do for this condition if you have golfer's elbow. The very first thing is you want to get increased blood flow to these tendons here, which are your flexor tendons. So as Tyler opens up and I'll show him exactly where he needs to be. So friction massage back and forth over this area. So Ty, find this spot where you feel the most tender. For me, it's a little bit more in the back. And you're going to use your index finger and your long finger. You're going to come down at kind of a 45-degree angle, and all you're going to do is go back and forth. If you can't get it, you can also use your thumb. But back and forth over this area will do a couple things. Number one, it desensitizes the tissue, which is really, really important because it's quite painful as that tendon attaches to the bone. Secondly, it increases the blood flow. So when tendons get injured, scar tissue lays down in that area and it restricts that blood flow. So right now you're getting in new blood flow to that area, which is really good. So about a 3 to 5 minute massage is really fantastic. And lastly, we may be breaking down some of that scar tissue as well. So friction massage really works out nicely. Okay, the next thing is we want to stretch that area. So to stretch the common flexor tendons, you actually palm faces down and you're going to use overpressure. And you're just going to keep your elbow straight. You're going to hold that stretch. And you're going to say there are 3 to 5 breaths. Maybe do about 5 of these guys. You can also add a little bit of an angle where you bring your hand out a little bit and in a little bit, as if you're going from 3 to 6 o'clock down here, if that feels like it gets a little bit more of a stretch for you. Okay? Important thing that you don't want to do. This is an overuse, right? So the last thing we want to do is load up dumbbells and overuse it further with doing flexion curls. Wrong thing to do. So we want to kind of get over that overuse, but instead of doing these kind of curls, which is a no-no early on, we're going to flip that hand over. So get your elbow straight and your wrist up. Take a hold of this. And now you're going to do wrist extension curls. Okay, nice and easy, elbow stays straight. So what Tyler's actually doing is he's working the opposite muscle group, and as he's doing that, it looks, when he's here, just like our stretch. So it's actually a really good thing. So always, the tip here with this is, you do not want to be using heavy weights. 1 to 5 pounds, start with 1. And we like to use these muscles, they're endurance muscles. So you don't want to be loading up like you would your biceps or your triceps. You want to be using nothing more than 1 to 5 pounds and 15 reps, 2 sets of 15, 3 sets of 15, then you can go up to the next weight. So those things are really good for golfer's elbow. The other thing that's amazing for that is our Class 4 laser. Class 4 laser is a modality that introduces infrared light to that tissue, breaks down scar tissue, stimulates the immune system, lays down new collagen and stem cells, so this baby can heal with normal tissue instead of scar tissue. The scar tissue doesn't do anything good. So if you're interested in that, give our office a call. Thanks.